everyone. Today we're going to talk about something important, dental health. It's something that matters to all of us. I'm Shy and I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking about with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out this year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone. And now let's welcome Dr. V and we'll start our holiday show.
Awesome. Very good. Very good. Hi everyone, welcome to our holiday edition of our Dental Dilemmas, and thank you for being the loyal followers for the last year, and we are very excited to present this special holiday show. As you guys know, I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm really excited to be here with you all today, especially during the holidays. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that surround your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. That's a fancy way of just saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have, as you guys know, 4 offices in the Dallas-Fort Worth area in Texas. We are all about making sure that your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth or gums. You can ask your questions live here right now, or you can send them your questions for our next show. Your questions really help us make these shows really helpful to everyone, not just you. And one more thing. If you like what you're learning here and seeing here, please let us know. Your feedback is super important to us. Don't forget to like and subscribe to our channel so you won't miss out on any of our latest updates and helpful tips that we are going to share here about your dental and gum health. I'm looking forward to talking with you and answering any questions you all might have. Let's make our smiles the best they can be, and I'm going to say the holiday smiles the best they can be. Let's get started with our holiday show.
Let's do it. So we already have questions from some of our viewers. Thank you guys. Hi doctor. I've been following your Q&A sessions for quite some time and I find them incredibly helpful. Thank you for sharing your expertise. I wasn't aware of the laser options available for gum brightening procedures until recently, and I decided to try it. I'm very happy with the results. My dentist mentioned that the results will last forever, but I'm curious, is that true? If not, how often would I need to repeat the procedure?
Well, you guys pretty much might have figured what I'm going to say. It really depends, right? So it is going to vary depending on person to person. I wish I could give you a cookie cutter answer. Or it stays for 6 months or 6 years. So I really can't give you a definitive answer. So what we call it as the longevity or the prognosis or the results, they last over a period of time. Sometimes it could be as low as like a couple of years. It could be as high as about 5 to 10 years. Don't worry about like whether it is going to last or not. Sometimes it may not be like completely back to normal. If it starts coming back to your normal pigmented or a colored gums, you may just have to repeat the procedure. Sometimes you may not have to repeat the whole long lengthy procedure or the extensive procedure. It's just like doing some aesthetic procedures, particularly if you guys are familiar. Sometimes you may have to do some touch-ups here and there, right? So you may have to do some depigmentation here and there. Maintaining is critical because sometimes if you're not taking care of the gums really well, the pigmentation may return sooner. So that is something like really critical. So what that means is you do your homework as we did the hard work to try and depigment your gums. You got to maintain your oral hygiene, avoid smoking, limiting some stained foods or anything that's going to pigment your or darken your gums, and make sure that you are going to visit the dentist on a regular basis. And those are the things that you can do to take care of to minimize repeating the procedure. Again, to answer your question, the results from the gum whitening can last for years.
Perfect. Very good. Alrighty, so we'll get into our next one. Hey, Dr. V, what are some quick cosmetic fixes for a brighter smile before the holiday photos?
Right on time for the holidays.
Right on time.
Right? Yeah. So this is one of the most common things. We got so many patients that are coming in, particularly during this busy holiday season. They are concerned about having white teeth, having a polished and clean teeth and gums, and they're asking for what can they do to maintain that. So a lot of things that you could do at home, particularly if you are not able to get into a dental appointment. There is still like a lot of time. We call it as a year-end madness. This is one of the best time to use the benefits if you have dental benefits, so you can max out on your dental benefits. So in addition to visiting the dentist, they can do a professional cleaning, professional teeth whitening. We do professional deep cleaning and the professional whitening also in our office. So come see us if you happen to be in the Dallas-Fort Worth area. So things that you could do to take care of your holiday photos: teeth whitening, polishing and cleaning at home. You can buy some DIY stuff from the local grocery store or the departmental store or the drugstore or even from Amazon. Whitening toothpaste. This is one of the great things. And whitening strips. You can buy some strips and you can stick on them. And another great trick for the women patients are having some cosmetic like lipstick and lipsticks, yeah. Right? Yeah. And then most importantly, you may be attending a lot of parties, and so make sure that when you are attending the parties, avoid drinking red wine, because red wine may stain. Coffee might stain your teeth also. Do that. And then the soda, particularly the Coke, and particularly if you're whitening, when you're drinking some colored soda, that might get the color stain back quickly on. So avoid that at least during the holidays. And those are the things that I could think of. Anything else you can think of, ma'am?
I think you touched all bases, but I love the lipstick idea. We love a lipstick. Absolutely. Men should try it too.
Okay, man.
Absolutely.
Man? All right.
Try
it out, right? Okay.
Perfect. Alrighty. I watched your video on bad breath following wisdom teeth extraction procedure. And while I have no infection after the extraction, the smell is unbearable. I'm concerned about the office tomorrow and plan to wear a mask to avoid embarrassing others. Is there anything I can do to improve this situation?
You had a surgical procedure done, wisdom teeth extraction. So the way the wisdom teeth extraction works, as if you guys have gone through a procedure or any extraction procedure, anytime you remove a tooth, you have a hole in the gum or hole in the bone that has to heal. There is no other way to get around that. Your body has to heal. The mother nature has to heal the bone and the gum where the tooth came out from. So there is no way around that. So the only thing that you can do to avoid the bad breath, and let's step back up a little bit. And the reason you are getting the bad breath is because you're going to have some food stuck. Imagine if this is the hole and you're going to have some food stuck in there. No matter how you try to keep it clean, you are still going to have some food stuck in there, particularly for the first week or a few days. we are going to ask you to not avoid vigorously rinsing your mouth or even brushing the area, which means that you are going to have some left out food. Imagine leaving some food on the counter for a few days. It is going to smell yucky, right? It's the same way. So that's why the food gets yucky there, it gets stuck in there. That's what is causing the bad breath. So forget about the bad breath, or I'm sure your friends or your family will excuse that, or your spouse or the significant other will excuse, and then they will understand. So things that you could avoid to avoid the bad breath would be keeping your mouth clean. Make sure that you are going to follow the instructions given by your dental office, like using the mouthwash. Sometimes we use the gel that we give, the healing gel. So the socket gel. So avoid that. Avoid having some strong spicy foods, and that sometimes can trigger the bad breath you may already have. And then avoid some sugary food, because the sugar gets fermented, which is what causes the bad breath. Avoid that. Avoid have a lot of protein or like any fatty food like that is going to avoid the starch, the bad breath from the sugar. And then again, as I said, it is just a temporary, right? So avoid the temporary, and it's temporary. You're going to get over. And other things that you could do is the Listerine strips, or the Listerine the mouth strips. You use like a mouthwash, like it's like a strip. You can do that. Tic Tacs, you can do that as well. Tic Tacs, yeah. And then maybe like any mint should do. And then one of the things that we do is like a TheraBreath, so which is going to help you avoid the bad breath, on biotin mouthwash. So you can use some special mouthwashes as well.
Exactly, or just blame it on the person you're talking to.
There we go.
Yeah, it's not even you.
Yeah.
Okay. Doc, I'm traveling abroad for the holidays. What are some must-have dental emergency items to pack? I think we all need this one.
Absolutely. You want to throw in a few before I say anything?
Sure. The travel size mouthwashes.
There we go.
I keep those. Travel size toothbrush that you can like always keep on your person. What are some other things? The Listerine strips. I like those too.
Yeah.
Okay, I'm not giving away all my secrets.
Oh, you're not going to reveal all your secrets.
No, my secrets.
So you want me to?
Yeah.
All right. Okay. All right. So the things that you could do: the travel side toothbrushes. You want to make sure that when she said mouthwash, and those are going to be the travel sizes, because the airline won't let you take the bigger mouthwashes. And sometimes we do have we have patients coming in having procedures done that they're traveling. So even when you're traveling, when we give medicated mouthwash, or the pharmacy gives you the medicated mouthwash, make sure that you are leaving the sticker on, or if we are dispensing or your dental office is dispensing, make sure that we are going to give you a prescription so you can take it on the plane with you. So by the way, the travel toothpaste, travel toothbrush, mouthwashes, dental flosses. Sometimes we call it as an over-the-counter filling. Over-the-counter fillings are like, let's say you have a lot of dental work in your mouth, and when the filling comes out, you can buy these again over-the-counter filling materials from the departmental store or the drugstore, or even from Amazon. So keep it with you just in case, because you don't want to be stuck during the holidays when nobody is open. Guess what? Murphy's Law is always going to happen. You don't want that to happen. So keep some in your purse. For people who have braces, or like even with the fillings, if you want to have some temporary relief, you can buy some wax. So the waxes are the orthodontic waxes, we call them. So either if you have braces, you can stick on them, or even if you have a hole that you are hurting possibly from, you can stick some wax. And one of the greatest things I recommend, I tell my patients, is chew gum, not on the side that you're hurting, but on the other side, and then leave the gum on the side that you're hurting. That's one of the greatest tricks that you can do. Get some ice packs with you. So one of the great ways to relieve the pain is the ice packs. So take some ice packs with you, and take your dentist contact information. Even though your dentist may not be in the office, at least they may be answering the phone, or their assistant may be answering the phone. Take your dentist contact information, and particularly if you have any dental problems and know where you are going, and then maybe just know where the emergency. the worst case, I'm sure you can probably call like a 24/7 emergency dentist, whichever area that you are in. And then if you have any travel insurance coverage, if you guys are traveling, make sure that you are going to have insurance coverage, and your insurance will kick into the place wherever you are going to be. If you're going to be traveling within the US, for most people, coverage is going to be there, and you should be fine.
Absolutely. Make a list and check it twice, you guys. Perfect. Hi, doctor. My son is 12 years old and he has crowded teeth and seemingly small jaw. Our dentist has recommended an appliance to help the jaw grow. However, they mentioned that while growth can be initiated, full potential growth cannot be achieved. I don't quite understand why full growth potential cannot be reached. Should I go ahead with the appliance? What are the disadvantages of not using it?
So what they're talking about is when the jaw, when the boys or the girls, when the kids grow, so there is something we call it as a suture. So right here. So if you guys can see the jawbone, there is what we call it as in the midline. So the jaw kind of like in two parts, our right side of the face and then the left side of the face. So whenever the jaw is growing and the suture is there in between, and it fuses after at a certain age. So when they are in the growing age, and that's one of the reasons why they say, hey, don't watch the baby's heads, because it's wide open right here before the skull completely closes. So the same way, the teeth when or the jawbone before they completely fuse, if you have crowding, so if you are able to what we call it as an expansion, so if you are able to expand, then the teeth will have room to come through. So the advantage of using the appliance, the one that you are being recommended, is to when the jawbone expands, it's going to allow for the teeth to come through, so you can avoid some teeth to be removed for the braces purposes later on. I cannot think of any kind of a disadvantage from really using that, other than, well, you're going to have maybe a longer period of time, because if you are going to do the expansion actually before you get the braces on, so you're going to have another period of time. You're going to have these expanders on the kid for maybe another like a couple of years or a year, depending on how much of expansion need to be achieved. So to answer your question, my recommendation would be you definitely consider, if you're seeing an orthodontist who is one of the specialists who is going to recommend this, I would strongly recommend you have a conversation, and my recommendation would be absolutely you consider that in the best interest of your child.
Absolutely. So you guys start sending in your live questions, and we will go into the next one. Hi, Dr. Vadivel. I came across an email about ToothHQ's holiday special offering 50% off laser cleaning, and I'm interested. Could you share more details about what's included in this offer? Also, how is it different from laser whitening?
Well, you want to try that? 50% off, all right.
No.
All right. Okay. So what the laser whitening is, as you guys know, like most of you guys follow us, and so there is a different type of cleanings that are available. So whenever you are getting a cleaning done at a dental office which do not offer the laser, so they just do a regular cleaning that involves cleaning using the mechanical instrument, but they do not pass the laser around to decontaminate the bacteria. So one of the great ways to avoid the bad breath, and particularly short term, would be to kill those bacteria. If you guys were watching the show earlier, we talked about leaving the food on the counter, which is what causes the bad breath. So leaving the bad bacteria under the gum line is what causes the bad breath. So by killing the bacteria, you're going to get some real freshness. So what we do in our office is we offer the regular cleaning along with the laser, and we offer the deep cleaning. And whenever we offer the deep cleaning or the deep gum therapy, we call it, we use the laser after we finish the deep gum therapy to decontaminate the gum and do what we call it as a laser bacterial reduction also. And also, the next step is when patients have advanced gum disease, we do laser gum surgery to avoid, to make it as a non-invasive procedure. Even during that time, we are using the laser to decontaminate and then do the bacterial reduction also. All of these procedures that we are talking about, whenever we are using the laser procedure is an added cost on the top of the regular cleaning that you get. So we offer 50% off of that laser. That way you can take advantage of having a fresh and fresh breath for the holidays. So and then expedite the healing process, which I call it, right? So if you are going to take, let's say, 3 months for the bad breath to get better, so you by immediately killing those bacteria, and you are going to expedite your healing process, and thereby you are going to have like a faster, fresher breath.
Absolutely, and we like clean and fresh. So go for it, you guys. Get your laser treatments. Thank you, everyone, for sending in your live questions. We're going to go ahead and take a couple of the viewer questions. You ready for this?
Yeah, live? Okay.
All right.
Okay.
So, what are the effects of wine or holiday drinks like eggnog on oral health?
All right. Okay, so right on time for the holidays, huh?
That's right.
Okay. So the wine, as you guys know, wine is acidic, and particularly if you're drinking red wine, it can stain your teeth. Acidic wine, it may cause damage to the enamel, particularly if you already had some whitening done or any dental treatment done, it can damage the surface of the tooth. Eggnog, as you guys know, it contains sugar, so sugar is harmful. And sugar has harmful bacteria that can damage your teeth. Alcohol, as you guys know, can cause dry mouth. Dry mouth in return may cause cavities, and also the dry mouth was going to, because of the dryness, it is going to cause the salivary flow in your mouth, and then that is again in turn going to cause cavities. Sugary cocktails, again, sugar causes plaque buildup, or sugar causes bacteria, and which in return is going to cause cavities. So I'm not going to say everything is bad. Yeah, watch what you're doing. Like, we are there to enjoy the holidays, have fun while you're having fun with the wine and the eggnog and the alcohol and the sugary cocktail. Watch what you do, and then tips to take care of, like while you're doing this, right? Rinse your mouth thoroughly, right after drinking wine or right after drinking alcohol, and then again, enjoy in moderation. Anything sugar, eggnog, or alcohol, anything in moderation, you can definitely take care of your teeth.
Absolutely. My recommendation would be to live it up and then come get your cleaning with laser, and we reset it all for you.
Absolutely, yeah. One of the greatest thing that I recommend is not immediately. Don't have alcohol, then go brush your teeth, or don't have wine and immediately brush your teeth. After you get your wine, and if you're done with wine, and maybe leave a few minutes, or have some fibrous food, like just going to take the coating off the alcohol from the teeth and go brush your teeth, and so it's not leaving any acidic material on your teeth. That's going to prevent some damage.
That's right. Alrighty, well, thank you guys. We'll get back into live questions in a moment. Doc, I had my lower back teeth filled about 4 years ago, and I haven't had any discomfort until today. However, I felt slight pain when I ate sweet candies. The pain goes away after I brush my teeth. Should I be worried about this, or does it indicate that my filling might be deteriorating?
So anytime you have a filling, this is one of the most common myth people think. Oh, Doc, I already had a cavity, and I had my cavity removed, and then I got a filling, and they think life is good. Unfortunately, life is not good, because when you have a cavity, and when we as dentists, when we remove the cavity, we are removing the active decay as much as possible. So what you have is under the filling, although you may not have a cavity, and you are going to have in between the tooth and the filling, what we call it as a micro leakage. Micro leakage is going to happen. So it is going to happen. It's kind of like a slow, very slowest plumbing leak that you can think of, right? So the slow leak is going to happen. So you're going to have some micro leakage because of the filling, because it just expands and contracts, because of the hot or cold food that you eat. But it happens. It takes like years for that to happen. So you have what we call it as a micro leakage that happens under the filling. Again, that decay is going to spread into the nerve, because the decay is going to spread under the filling into the nerve. More than likely, the reason that you are experiencing pain, although you said, just like we talked about, it takes years. So about 3 or 4 years since you had this filling done, now you are starting to experience some sensitivity and some pain. It is because of that micro leakage. So my recommendation is, before it gets worse, more than likely sometime, if it is just what we call it as a conductivity issue, what that means is, if the filling is conducting all the stimulus onto the nerve, if you are able to change the filling, let's say a part of the filling is broken or the filling has gone bad. Now if we are going to go early, now they are able to remove the filling, or maybe even make a new crown for the tooth. But if you leave it for too long, you are going to need a root canal treatment once the cavity reaches the nerve. So my recommendation is, go see the dentist as soon as possible to redo the filling or make a crown for the tooth to avoid getting a root canal. Even so be it, like if the nerve the cavity has already reached the nerve, your dentist should still be able to evaluate the tooth to see whether you need a root canal, followed by giving you a crown or a filling.
Perfect. Really good advice. How can I make sure my kids' teeth stays healthy with all the holiday candies around? Don't give them any candy.
Man, you're going to have upset kids if you're going to do that, right? Well, just like the adults, as we want to enjoy the wine and the holiday drinks and all of that, the kids want to enjoy the holidays as well. Just give it to them, but make sure that you're going to give it to them in moderation, right? So limit the sugary treats. So you can eat them. Make sure that you are going to do it in moderation. Choose some tooth-friendly options, like for chocolates instead of sticky hot candies. The reason you want to avoid the sticky hot candies, because they're going to get stuck and they are going to be very hard to remove, and they are going to get stuck on, particularly if the kids are having those sticky hot candies at night before they go to bed. They are going to stay on the tooth for the rest of the night, and then they are going to keep acting, leaving this acidic nature on the surface and the bacteria and all of that throughout night. So you want to avoid that. And then, as I said, you don't want to eat a candy, and particularly you don't want to eat a sticky candy, or you don't want the kids to eat the sticky candy and go to bed. Encourage brushing. So definitely they need to be brushing before they go to bed. And then instead of candies, offer healthy snacks. If the kids want celery, it's a great one. The kids love them. Some salads, and so just give them some salads, or maybe after they eat the candy, give them a celery stick, because they're going to eat the fiber now. They're going to get rid of all the sticky stuff from the teeth. That's a good one. And stay hydrated. Drink a lot of water. Water really is good for your body, as well as it's just going to rinse all the bacteria away or the candy away. So drink a lot of water, and then make sure that if you have cultured your kid to do the brushing and the flossing properly, and then they are going to follow. Make sure that you are going to supervise them as they enjoy the holiday with the treats.
That's right.
Yeah.
Give them celery. Okay. You ready for a game?
Yeah.
It's our favorite segment, you guys. All right, so we're going to play rapid fire.
What does that mean?
Rapid fire means you have to answer the question in less than 30 seconds in like 1 to 2 sentences.
Okay.
All right.
Okay.
Here we go. What's your favorite dental tool and why?
My favorite tool is the dental probe and the dental mirror. So I say my probe, which is my measuring tool. I call it as my thinking stick. I cannot think without that. Sometimes I just hold it just because, Doc, you're not doing anything. What are you doing with that? And I call it as my thinking stick. So the dental probe and my mirror.
Okay, Santa was listening.
Mm-hmm.
Do you believe in holistic dentistry? Why or why not?
Holistic dentistry, absolutely. So we call it as a comprehensive dentistry. The holistic dentistry is another biologic dentistry. So we all live in this green world, right? So we want to add biologic. So absolutely, we believe in it. I absolutely recommend you do the biologic dentistry as well. Yeah.
Absolutely.
Or the holistic dentistry. Yeah.
Holistic, yes. Would an electric toothbrush make a good Christmas gift for my 7-year-old niece?
Absolutely. It is a great idea. Kids love the electric toothbrushes, and particularly nowadays you can get them with a lot of cool gadgets and then smart apps and everything. And then they especially make the electric toothbrushes for the kids. So, absolutely a fantastic idea.
Perfect. Coffee or tea? Which one is worth for our teeth?
Um, Both kind of stain the teeth. Whether you drink coffee or tea, it doesn't matter. They are both going to. But one good thing is what we have tested, or what the research shows, is whenever you are adding some creamer to your teeth, it stains your teeth less than what it would when you're drinking a black tea or a black coffee. So add some creamer. Sugar is not the best. If you're really wanting some sugar, go for some sugar supplements. I would recommend that.
Okay. I knew I was doing it right. I never drink black. I knew that. All right. What is the best festive snack that's actually good for our teeth? Celery.
Well, there we go. I'm glad you remember that. Right. Okay. So, cheese. Anything cheese is a good one. It doesn't have a lot of carbohydrate. The salads, Shai said that celery stick, that's a really good one, and holiday spreads, and so those are good ones. And anything not sugary, I'm going to go for it, right? And those are all decent stuff for the holidays. And then anything that you can avoid, like anything sugar or acid, that is something that I would recommend, and keep your smile fresh.
That's right.
Okay.
Come see us for your cleaning and laser treatment.
Yeah. Mm-hmm.
Alrighty, so that ends rapid fire. I think you did well.
All right, man.
You kept it sweet, or what do we say? Kiss.
What did you say?
You kept it kiss.
Oh, thank you.
What does kiss mean? Do you guys know what kiss means?
No.
You know what it means.
What are you
Keep
talking?
it short and simple.
Oh, yeah. Okay. All right.
Come on.
Okay. All right.
That's his jargon. That's the terrible part about it.
You said it wrong.
Oh.
I said kiss. Keep it super simple.
That's what I said.
Okay. All right. Okay.
What
Maybe I didn't hear it right.
See you.
Yeah.
It's the fluff ball. Alrighty. Hi, doctor. My name is Sophia, and I'm 35 years old. I have dental insurance, which I've already used twice this year for root canal treatments. As a result, I'm unable to get any surgical procedures covered for the rest of the year. Could you clarify under which category laser gum therapy falls? Would it be eligible for a claim this year, or should I wait until next year?
So, the first thing is, irrespective of whether you have benefits left over for this year or not, first thing that, why don't you say what we do? Like when they come in, what do? We verify their benefits.
That's
For any
right.
procedure that we do, including, go ahead.
Okay. So we'll verify your benefits, and once we put a treatment plan together for you, we definitely strategize whether we should utilize the benefits, currently, or if it's something that we can utilize your benefits for next year. That way you get to optimize your benefits that you pay for all year long.
Right, but let's say that we have a treatment plan, like I'm going to pick a number here. Let's say it is going to cost around $2,000, right? So you have some benefit that you can for this year, and then you have some benefit that you can apply. So what do you do?
Absolutely. We utilize them for this year.
and you split that, and then you get half the treatment done
That's
this
right.
year, and then particularly being towards the end of the year, and so we split the treatment half done this year, and then half done next year.
That's right.
Okay.
We
So
optimize it.
to answer your question, if you already have maxed out your benefits, can you really wait until next year? Possibly, unless you have something emergency. I would recommend that you do not wait, because we talked about this earlier. Murphy's law. It always happens when you don't want that to happen. When you go out of town, or when you don't have anybody around, it happens at 6 p.m. on Friday night. So you don't want this. Definitely, people are going to have some long holiday closures, so you don't want to have anything happen. So if there is something that elective that you can wait, but there is something that your dentist has recommended, check with them and make sure you're going to get this done before the holiday madness ends. And then if it is something that you're not sure that whether the benefits are going to be covered or not, talk to the dental office. As Shai said earlier, when you come to our office, we are going to check the benefits and see what are your benefits, and then what can we do to apply this year and next year. So to answer your question again, talk to your dental team and prioritize the treatment. Have them give you an action plan. This has to be done, this can wait, and all of that, and they could help you insurance wise as well as financial wise.
That's right. Absolutely. Come see us. Alrighty. I'm 67 and often experience dry mouth, which gets worse during the cold holiday season. What can I do to manage it better and enjoy the festivities?
So it's not uncommon for you to have a dry mouth, particularly as you get older, particularly when patients are taking multiple medication, particularly for high blood pressure, diabetes, and anxiety and depression and all of that. All of these medications have a tendency to cause the dry mouth. So there are multiple ways to combat the dry mouth. And of course, you can't quit taking medication. You got to keep taking medication and keep you healthy, as well as particularly during the time of the holiday. So multiple ways that you could to combat the dry mouth would be drink a lot of water. We already talked about this. Avoid the alcohol, because alcohol is going to make your mouth dry. And then avoid caffeine. Caffeine, or like anything, coffee or tea, that is going to make your mouth dry. Also, use some alcohol-free mouthwash, because the alcohol, even the mouthwash, you may be thinking, oh, I'm using the mouthwash to treat my dryness, but you may not know the alcohol contains mouthwash. So make sure that you are going to pick a mouthwash that is alcohol free. Try the saliva substitutes, and you may be able to the chewing gum, the sugar-free chewing gum is good, but do not overdo it. Maybe like once in a while, like one or two, or maybe one a day. That is going to help. Suck on ice cube, like you can leave the ice cube in your mouth. That is going to keep your mouth hydrated for a long period of time. Limit the salt and spicy food, because sometimes spicy food can make your mouth kind of dry, and so that is something that you can do also. And if you have your mouth especially feels dry and things have changed, and my recommendation is go see the dentist to see whether there is something has changed, and those are my recommendations.
Okay, perfect. Best of luck with that. I experienced temporomandibular joint, better known as TMJ, issues during my military service, which I believe were caused by wearing tight helmets all day. After I left the military, those problems disappeared. Can you explain how such physical stressors might contribute to TMJ disorders?
So, when you're referring to the TMJ problems, and it is not uncommon for not just people in the military, we see people all day long, people have TMJ issues. So, many reasons, even kids who have braces. When they have like a lot of when they wear braces, and that can cause even some TMJ issues. And then kids, when they grow up, they grind their teeth, and that can even cause some TMJ issues. What we call, this is the TMJ. So when you have the lower jaw, when it goes and attaches to the base of the skull here, this is what we call it as a TMJ. This is where the wear happens. So just like when you have a knee, on the knee, there you may have some damage as you get older. The same damage may happen here irrespective of the age, the damage can happen in the knee. Irrespective of the age, this is another joint, just like the what we call it as a ball and a socket joint right here. So the ball and socket joint, that's what it is, and you can have some damage. So what can you do? How can it be linked to physical stress? Because it could be related to you wearing the helmet, or it could be related to you grinding your teeth at night, or even clenching it during the day, or particularly if you're in the military, you may be like just using the gun, and when you have a lot of movement, that can cause some damage to the teeth also. What can you do to recover from that, right? So one thing that we do is what we call it as a night guard, or like a bite guard, so you can wear in between the top and the bottom teeth, and it looks like something like this right here. See that? So you can wear them in between, so it is going to prevent the damage between the top and the bottom teeth, and that is something that you can do. And as a veteran, and there is a lot of support services that are available. So talk to if you're attached to the VA hospital. VA hospital offers a lot of services for the dental services. Talk to them. And then sometime as at ToothHQ, we offer specials for the veterans, and just come see us, and we can definitely help you as well.
Absolutely.
Including taking care of the holiday specials.
That's right. And thank you for your service.
Yeah.
And so we're going to give you guys a gift by reading the comments and see what's going on. Let's see what questions you guys have. So, I have sensitive teeth, and the cold during the Christmas vacation makes it worse. Any tips for enjoying holiday treats without discomfort?
So sensitive teeth during the holidays, and make sure that the sensitive teeth is not due to the cavity. If it is not due to the cavity, a lot of cool things that you could do, right? Just some over-the-counter toothpaste, sensitive toothpaste like Sensodyne, or any anti-sensitivity toothpaste that you can get it from the departmental store or the drugstore that you go to, or like even from Amazon, you can get that. And avoid the acidic food that is going to make it sensitive, coffee or tea, and those are going to make the teeth even more sensitive. And then real sugary stuff, like something like really sugary, like a candy, or particularly the sticky candies, they are going to make the teeth really sensitive if it is related to the cavity that you are experiencing. So that is something that I would highly recommend you avoid as well. And then the things that you can do to take care of would be to use a soft bristle, soft or medium, instead of using a hard one, because you're going to scrub your teeth and you're going to damage it even more. So avoid that. And then brush gently and use a mouthwash. When you're using a mouthwash, again, make sure that you're picking a mouthwash that does not have alcohol. And then also, instead of using an alcohol related mouthwash, or like even you're using a non-alcohol mouthwash, buy a fluoride mouthwash. In addition to using a fluoride or the anti-sensitivity toothpaste, use a fluoride mouthwash that is going to leave a coating on the sensitive teeth. That is going to really help taking care of the sensitive teeth also.
Perfect. Okay. All right. So I was scrolling through and I saw a really good question. Should we do another?
Yeah.
Alrighty. Dr. Vadivel, I noticed at ToothHQ Facebook ad offering 50% off dental implants for this holiday season. Is this real? If so, how does the discount work?
How many deals have you done?
At least 25 today. Okay.
25.
Today.
Yeah?
Today.
Okay.
Absolutely.
Okay, so tell them like how does the 50% off work?
Yeah, absolutely. So one, you come in and you get a free consultation at CBCT. Yeah, so you come and see us. At that point, we have a doctor do a clinical exam. We put a treatment plan together for you. We prioritize it as he mentioned, and then we apply discounts where necessary.
Absolutely.
Yeah.
So we do have like a 50% discount on multiple treatment. We have a 50% off on the laser, 50% off of the extraction, 50% off of gum therapy, 50% off of the laser therapy, 50% off of the dental implant. 50% off of the wisdom teeth extraction. So we have multiple discounts that we offer. So all you have to do is
come get a free
there
consultation
we
in
go.
CBCT.
Right?
Oh, come see us.
Come see us.
Was that our moment? Come see
Yeah.
us.
Yeah, that's what I was going to.
That's what you were going
No,
for?
I was going to
Is
say.
that- okay. Come see us.
Come
yes.
see us. Yeah, we are here for
Absolutely.
you. And if our phone lines are busy, just keep calling. So we are going to
That's
come
right.
get you. And the easiest way to do it is to make the appointment. You don't have to wait for Miss Shai because she is busy taking care of patient.
That's right.
And so make an appointment online, and we are going to see you. And we are going to this is a good time to give a shout out for Diana.
Oh, yes. Miss Diana will answer the phone.
Yeah.
Shout out to our favorite office manager, Diana.
Yeah, so make sure call the office and ask for Diana, and you will see the smiling face. I'm telling you, you will see the smiling face. I know you can't see her face, but you will see
You'll hear
her
it.
smile. You will hear her smiling. Yeah.
Absolutely. Perfect. Alrighty. So please keep sending your questions in, and we'll definitely address them during the next one. All right. So to jump back in, I experienced temporal mandibular joint.
No, we already did that.
Just joking. I'm sorry, you guys. Wait.
Sorry, yeah.
Okay. I don't know what
Are
happened.
you testing that I'm awake or
Yeah,
not?
are you paying attention? Okay, I was just
Oh,
checking.
man.
Maybe
All
they
right.
wanted to hear again. You don't know. Okay. I had a dental implant placed 2 weeks ago. Are there any special care tips I should follow during the Christmas holiday?
I'm sure you probably heard from your dental office a lot of tips about how can you maintain your dental implants or taking care of your implants healthy during the holidays. Do not chew on that side. Absolutely do not chew on that side. Although you got the dental implant, you definitely don't want to chew on that side and do any damage, particularly hard candies or anything hard food or anything like a nut. You don't want to chew on that side. You want to use the mouthwash that we normally give, the medicated mouthwash, to keep the bacteria and even the little bit of food that you do on the other side when it goes on the side that you had the dental implant procedure done. So you want to keep that healthy. If you have full mouth of implants done, again, pick something kind of soft diet, so that way you're not like hurting any of the implants at all. And use the ice pack. Ice pack is going to help decrease the swelling. Take the antibiotics and the pain medications and the anti-inflammatory. The dental office, your dentist or the dental office would have given you. Watch for any type of infections like a really bad breath, increasing bad breath, or increasing pain, or increasing swelling, and contact your dentist. If you have anything of that sort happen, I'm sure with the holidays coming, you still want to enjoy the holiday. So whatever that you are doing, do it in moderation. Can you cheat a little bit on the alcohol? Possibly, but not when you take the stronger pain medication. I don't recommend you do that. Again, if you're eating something, like maybe eat a softer candy, not the regular candy. Be gentle, whatever that you are trying to eat. Drink a lot of water. Stay yourself hydrated. Follow pretty much the dental office the instruction they gave you.
That's right. I recently underwent a LANAP procedure, and I've been noticing bleeding from my gums every morning while brushing. Could this be due to exerting too much pressure on my gums? Could you please explain some aftercare tips for post-laser gum treatment?
So, LANAP is a form of a non-invasive or microsurgical procedure, or advanced gum procedure or advanced laser procedure that we do to treat the gum disease. One thing that we really recommend that you do is to do not brush your teeth for 2 weeks. It's just going to feel yucky. Hey, what am I saying? Like, hey, he's a dentist and he's telling me not to brush my teeth. So the way the LANAP works, that once we clean out all the bacteria around the teeth, and then we are going to use a laser to form a blood clot or a sealant around the tooth. When you're brushing, you're probably breaking the seal. Part of the reason why you're possibly bleeding is because you're breaking that seal of the blood clot, and that's what is making you bleed. unless you are taking any type of medication like aspirin, and you may have a tendency to bleed. So do not brush your teeth for 2 weeks after the Lanap procedure. All you got to do is to use a mouthwash. So anytime you're using the mouthwash, even with the mouthwash, don't do that. So what I recommend is you take the mouthwash and hold it in the mouth like this for 2 minutes, and then do that again. Yeah, and hold it for 2 minutes. So if you have side procedure done on one side, do it like that. So make sure that you are going to hold it in the mouth and for 2 minutes, and then you spit that out. And you have to do that after each meal and after each snack, because you're not brushing. The only way that you are keeping your mouth clean is to use the mouthwash. So do that. And then after each meal and after each snack, again, just drink some water. So that is going to help cleanse the mouth also. Keep yourself hydrated. And as you know, avoid smoking. And that is going to really help also. And those are the things that you could do to take care of your mouth after the Lanap procedure.
Perfect. Alrighty. Hey, Doc. My 72-year-old mother started wearing dentures 2 months ago, and we're planning a vacation this Christmas. What should I do if her dentures crack or break during the trip?
Great question. Yeah, right. So take a dentist with you, or a dental lab guy with you, right? That's what I want to say. I know it's not practical, right? So things can happen. We talked about it earlier. Murphy's law always going to happen when you don't want that to happen. So if a denture breaks during the holidays, the best thing I recommend is, if you have an old pair of dentures sitting with you, take it with you. That is the best way to avoid any kind of a mess up to happen. And a lot of times, we hear, hey, the dog ate my denture, dog ate my teeth. That's not uncommon for that to happen. You can't find people during the holiday time. Even if I want to do the work, like if you want to come in at 5 o'clock, I want to do the work, sometimes when I'm dependent on the lab to make those teeth, sometimes we can't make them. Nowadays with the technology, we are able to make the same day teeth and then same day partials and all of that. So find an office like us, who have advanced technology. They can make the teeth on the same day for you. To going back to your question, so with breaks, you got to fix it, right? Particularly if you're traveling. So take some stuff. There is a lot of denture repair kits, DIY kits that are available that you can buy from your favorite departmental store or the drugstore, or even from Amazon. So make sure that you are going to take it with you. I've seen this happen, and although I do not recommend, do not do it every single time. But if you do not have anything handy, you can even use a little bit of a super glue to stick it out, stick them together. Although the super glue is going to damage your denture, so be it. At least to get by during the holiday time, so you can possibly do that. And then be prepared, right? So a lot of times, we see that happen because you accidentally drop it, or you do not store the denture. And then one common thing, I know I was not joking when I said the dog ate it, right? So it does happen. And then one of the common things that I hear is sometimes people take the denture out when they go out, and then they wrap it in a piece of paper and then leave it on the dinner table in the restaurant. Sometimes the buses, they just come and then remove it. So make sure that you are going to keep it safe in any place, and then don't give it to your dog. And then be prepared. If anything were to happen, take a denture repair kit with you.
That's right. Add that to your travel list.
And be prepared to, wherever you're going, and keep a directory of dentists that you're able to call, and then make sure you're going to take your dentist number also. Your dentist may have a buddy in the town that you're visiting, and they may be able to, with the technology, we are all connected very well, so we may be able to find somebody wherever you're visiting.
That's right. Hi, Dr. V. I'm 45 years old, and I recently had to have my upper second molar, last tooth, removed because it was completely decayed. My dentist mentioned that it is possible to place a bridge in this area. Is that true? Or what are the alternatives to a bridge in this case?
So, you want to take that?
Implant.
Yeah, okay. Go ahead.
An implant.
Implant. There we go. Right? Yeah. So the implant is the way to go. The way to go. So to answer your question, so what they are referring to is this is the last tooth here. This is the last tooth, the second molar. This is the upper tooth. When you lose that tooth, there is no way for you to replace that tooth with a bridge. The way the bridge happens, so if you see here, I don't know how well you guys can see it. So the bridge happens when you have two teeth on either side. When you have a missing tooth in the middle, then we put a bridge that goes, we prep the two teeth, and then we put a bridge over up on the top here. So that's the way the bridge have. This is a 3-unit bridge. So you have a prep tooth in the front, prep tooth in the back, and then you have a hanging tooth in the middle. However, when you lose a last tooth like this, you don't have any other option other than either you leave it alone, you do not replace, which we do not recommend, and of course you can get what we call it as a flipper, which is a partial denture that goes in and out the mouth, and you don't want to wear it for just one tooth because it is so uncomfortable. But the best way to do that would be to do what we call it as a implant. And where do we do it?
Here.
Here. Okay, come see us and we can do that for you.
That's right. Dr. V, I'm 26 and currently dealing with wisdom tooth pain. I plan to have them removed after the holiday season because I don't want dental visits and sutures disrupting my holidays. Are there any special precautions I should take during the winter? Do you recommend any over-the-counter medications or DIY tips to help minimize the pain until then?
Depending on how bad is the pain, right? My recommendation is, one of the common myths that I hear from people, they think that they are going to be hurting for weeks and weeks after getting the wisdom teeth out. So this is what I say, we are in a college town. Dallas is a very much of a college town we are in. We talk about it like 3 times, during the day, so we remove a lot of wisdom teeth on the college-going kids, and when the college-going kids come here from either from Austin or from College Station, they come here on a Friday evening or a Friday afternoon, they get the wisdom teeth out, they are driving back on Sunday evening by themselves. I don't even see them sometime for a follow-up. That is how quick of a recovery it could be, particularly if you are a young patient. The younger you are, the quicker you are going to recover. So my recommendation is, with the holidays, being almost like about 10 days away, right? Mm-hmm. 10 days, right?
Less than that.
Yeah, but yeah. So let's say you are in Dallas. Come tomorrow, see me, and then we can take care of you, and you're ready for the holidays. But anyway, even if you're not in Dallas, so go talk to the dentist and do not postpone, because Murphy's Law always happens when you don't want that to happen. So what can you do to take care of it if you really want to postpone it? Over-the-counter pain medication. Take Advil and Tylenol. And if you are a mom and you probably know watching it, when your kid has high fever, you're going to alternate the Advil and the Tylenol. Similar to that, then you can alternate the Tylenol and the Advil, every 3 to 6 hours. You can keep alternating that. Use a saltwater mouthwash. If you are going to use any medicated mouthwash, for you're going to buy over the counter, buy something that is a non-alcohol. Stay warm, because cold sometimes it's not good for your teeth and it's just going to make the pain really worse. Stay warm, so that is going to really help also. Good oral hygiene, particularly if you are going to leave a lot of food getting stuck in there, that is going to increase the pain. So make sure that you're keeping good oral hygiene, you're keeping your teeth really clean. Drink a lot of water. Water really, really helps. And then particularly, in addition to drinking water, which keeps your hydration level high to keep you healthy, it also cleanses a lot of bacteria, cleanses all the food away. That is going to really help also. And then avoid hard food, particularly really sticky candy, or if you are going to like a nut or something that you are going to crack, and if you are going to have the food getting stuck there or the nut getting stuck, that is going to cause some really, really bad pain. So avoid doing that, and then have an emergency plan. Particularly, you don't want to be traveling with this. Like if you happen to travel, make sure that you are going to find a dentist wherever you are. And the biggest challenge with the wisdom teeth, not all the dentists do the wisdom teeth. As you know, we are a specialist office. That is what we do here for a living. We do more wisdom teeth, and so anyway. So to find a dentist wherever you are traveling. And again, thank you all so much to be here.
Yes,
and
thank you.
you guys have like a very very happy and a safe holiday. And keep your smiles bright, and make sure that you are going to have a healthy smile. Follow all the safe tips that we recommended here, and you have a safe holiday and a healthy holiday and a happy holiday. And we will see you next year. Thank you very much.